Hello, everyone. Welcome back to the debate class. Long time no see. This week, we will be having a COVID theme. And the motion I have prepared for you is assuming safety. This house would make COVID-19 vaccine free and mandatory for everyone. Okay, before we go on, it is important that we go through the definition. So let's go through the definition. So definition for vaccine is a product that simulates a person's immune system to produce immunity. So I'm pretty sure as a baby or sometime in your life you have been vaccinated. I'm not a biologist or I'm not a doctor, but what basically vaccines do is that once you get injection, next time the germs come in, you already have an antibody, meaning that your body is ready to fight off that germs because your body already knows what kind of germs they are. So they know how to tackle it. So if you have a vaccine, then when the germs or the virus comes in, you will either not get sick or be very little impacted. So it's going to be going through very lightly for you. Now, we know the definition of free, so it's given or available without any charge. So nothing will be charged from you. It is for free. And what it mean by mandatory, it's a little bit of difficult word, but it is required by law or mandate, meaning you must do this because the government will ask you to do this. So again, when we look at the definition, it is we're assuming safety. The vaccines are out, but it is still in an early phase, but let's say we are all assuming that vaccines are safe for humans and children, then we're going to make it a required by law that we're going to make it free so that everyone will have a mandatory vaccination, just like smallpox or other type of vaccination. You go through vaccination to go to school. When you go to school, you need to provide some vaccination proof or certificate to go to school, right? So we're going to do that for COVID-19 as well. Okay, so let's go through a little bit more about the background. So, as we already know, that COVID-19 has raged the whole year of 2020. So, we got lockdowns, our schools went online, and many people lost their jobs when and a lot of restaurants and places need to close down. So, of course, year 2021 will not be as much different, but let's just talk about how much or how far we are in terms of where we are in vaccines, because I think it's important to know. So currently there are over 50 vaccines in trial according to World Health Organization, and some of them are already released like Pfizer, Moderna, or AstraZeneca. These vaccines are already being developed and they're being given out to people in healthcare. So let's look at some COVID vaccines and do some comparison. So we have Pfizer, Moderna, and also AstraZeneca. These go through how effectiveness is almost 95%. So it is quite effective. If you look at the cost, there some of them are as low as $4, but as you can see, effectiveness can go down. Some of them can be expensive at $33. This is in US dollars. So if you live in Hong Kong, that'll be around what $200 ish. If in Korean, it should be around 30,000 won or 40,000 won, depending on where you get it. So these are preliminary results. Now, other countries like China, Russia, they're all creating their own vaccines, and they say that it is as effective as other vaccines which are currently being distributed. So this is where we are. A lot of vaccines are underway, and pretty much in the later half of 2021, we will see a lot of these vaccines in our hospital being administered, being given out to people. Okay, so a little bit of background information, right? So we know how vaccines work by now. So it is targeting the COVID-19 vaccine. So once you get the vaccination, then obviously you will not get even if the virus comes into you, you won't be as sick, or maybe you won't have any symptoms. So those will be the good things about being vaccinated. Right now, a lot of healthcare workers, like doctors who see the patients, are currently being vaccinated. Are vaccination always working? Well, in very small cases, even if it's safe, in very, very small cases, you might have allergic reactions. Pain, fever, headache, muscle pain can be can be pretty common symptoms of side effects of vaccines. But this is not just about COVID vaccines. If you get vaccinated, for example, my son was vaccinated for influenza and he got slight fever that night. And that is one of the common symptoms of being vaccinated. But of course, if you have extreme allergic reactions, then obviously it might get a little bit more worse. And that's why doctors need to be careful about your allergic records and make sure that they administer the vaccines safely as possible. So vaccines, as you can see, it seems like a great idea, and it's like sounds like a great news that we are finally having COVID-19 vaccines. But in the eyes of being more a little bit more skeptical, can we say is this a perfect solution? Well, some say it may be, but the reality is, even if you're vaccinated, it will only protect you from getting sick and being ended up in a hospital. It is possible that even if you are vaccinated, you can still carry the virus and be contagious to other people. So if you're vaccinated, fine, you won't get sick. But if you do an achoo without a mask, then very likely someone who wasn't vaccinated might be able to catch the disease. So what it means is that it will only protect you, but it won't prevent from spreading the virus itself. We also see that these vaccines are, although some people will say this is quite reasonable, if you administer from the hospital, it could be 40 to $50 US dollars, which is around 300 to 400 Hong Kong dollars. But if you add it up, it's going to be a lot of money for people because COVID-19 is here to stay and you might have to get this vaccine every year. And currently, you have to get it twice a year. So the cost can go up to $1,000 $100 per person. And if you have like a large household, then you might actually these costs will be going to add up, right? So it is not super expensive, but it's not super cheap either. So these are some of the things that we have to be aware when we know about vaccines because we tend to think that vaccines are always going to be perfect. It's going to solve everything. But in reality, we have to do some reality check, right? So there are some monetary concerns. There are still some concerns about this virus will still mutate. It will still be able to be spread even if everyone is vaccinated. Okay, so going back to this motion. So if we know that fine, we know the vaccines are not a perfect solution for COVID-19, but it at least prevents everyone from getting it, then do you want to make COVID-19 vaccines free and then force people to get this vaccine? Even if you don't feel like getting one because you might get sick or you might spread even more, do you want this to be mandatory for everyone? And that's going to be really the crux of today's debate. Now, let's go into looking into the argumentation. So, I know this topic is quite intuitive. Everyone knows what COVID-19 is, everyone knows vaccine is, but you might feel like, okay, why does it matter? What kind of impact does it have? You might feel a little bit stuck. So, I hope that the arguments that we share can give you some food for thought to make you feel like, okay, these areas, I'm going to start thinking about it when I'm reading the topic. Okay, so if you're in the pro side saying, yeah, the government should make vaccines free, like this means that government will buy all these vaccines and they'll distribute to people. So they're going to use the tax money and then they're going to make it free for these injections for everyone, young and old, assuming this is absolutely safe. The value here is it is definitely within the government's responsibility to protect the citizen. And if you want to make it a stance or a team line, you want to say, look, these free and mandatory vaccine will benefit everyone in the long run. So here are the arguments. My first argument I share is that this is the fastest way to eradicate COVID-19. Now, by no means this is a perfect way, but if everyone in the room is vaccinated, then very likely the virus will not go viral. And at the same time, even if it affects people, it's going to minimize. That means that a lot of hospitals will not be clogged as much as this. And this also means that restaurants no longer need to be closed, schools will be open again. So this is the fastest route to get our lives back in track. So we want to make it free and we want to make it mandatory. So we're not going to give any excuse for people to not get vaccinated. We also say it is government's responsibility. saying that, look, by any means, that it is not just for one or two people, but government has to really look for the greater good of people. And that's why it is completely within the government's responsibility. If they have access to safe vaccines, they must make it free. They must make it free for everyone so that if they can help to solve the problem of COVID-19. You can also say it helps prevent future outbreaks because right now we see that the COVID-19 is having some variation. Different viruses are continuing to happen. And if we don't get everyone vaccinated, the problem is this outbreak will just go even worse and worse. So if number one argument is that we want to solve the current problem, we can also say if we make COVID vaccines free and mandatory, this will help prevent future outbreaks. When we have similar cases, now the government has the knowledge and means to really prevent the future things, future bad pandemics. In this case, it might happen. Lastly, you can say that nobody should gain profit off from COVID-19. One of the criticism that a lot of pharmaceutical companies have is that, look, you're going to make money out of people. You're going to make money out of pandemic. And we don't want to do this. And that's why we want to make it fair and equal for everyone. If the government buys a vaccine, there is very little chance that they're not going to rip off the government. Of course, they will still be able to reap off all the profit based on all the research they had to go through. But at the end, if the government is using the tax money to buy the vaccines, this means that no one can really they cannot really make the price super expensive because at the end of the day, it's just that it is the tax money that needs to be paid. So they need to be transparent. They need to lower down the money. So the bottom line of the number four is that no one should be gaining profit or no one should be abusing this COVID-19 pandemic to be a millionaire. And that's why we want to make the government be the one who's responsible for getting these vaccines, number one, and making this free for people and making it mandatory. And that's why the pro team has a lot of argumentation about like there is definitely an ethical issue that we need to really resolve by making sure that no one is getting abusing the system and becoming making money out of it. Okay, so those were the arguments that we can think of in the on the pro team. But if you think about it in a con team, then why do you want to say no to this, even though we like the fact that we have the vaccine? Well, first of all, you can say, look, it is great that we have vaccines, but we cannot force people to have vaccines, or we cannot force everything to be free. Uh, some people have their own beliefs about vaccination, and they might choose not to be vaccinated. And you're still asking them to pay tax, and then make sure that everyone is vaccinated using their tax money. At the end of the day, freedom of choice should be given to the individual. And that's why you put the team line as like, look, if you make vaccines free and mandatory, it does not benefit anything. The first argument is that people have a choice. Now, yes, it is given that a lot of doctors and scientists say it is very important that you get vaccinated, but it is at the end of the day, you're putting something into your own body. Then, if you have a choice, then as a mom, as a dad, or as an individual, then you are absolutely given the choice to decide what to put in your body. And this is different from mask. Wearing a mask, you don't really inject something into your body, but if you want to put in something that might have a long term effect, then you want to make sure that you have the full authority and the power to make a choice on your behalf. Secondly, you can also say that mandatory vaccine is not a perfect solution because we already said that vaccines the virus may mutate. It might also be the case that, look, even if you get vaccinated, you might also get COVID-19 or you might also spread it. So in this case, is there really a reason to put in billions of tax money to make it a vaccine free and mandatory for everyone? Wouldn't it be better that we leave it to the choice of the individuals and we keep wearing masks and having a social distance at this current status quo? The third argument you can think of is that it is a definite waste of tax money. According to the news, one of the senators in the United States have proposed that they will use $35 billion to make COVID-19 vaccines free for everyone. Now, if we are to do this twice every year and then do it every year, then that's going to be at least $70 billion per year. Now, that is just an estimation. when we get everyone to be vaccinated, that money will might go into 100 billions or even trillions of dollars if you add it up in many, many years. Then that means that the tax money that was allocated to other places like welfare or healthcare needs to be reduced. And we only focus on COVID-19 vaccines to make it free. Then what about other things like Zika virus or malaria? These other vaccines might be less subsidized, making it expensive. So if we put all our tax resource on COVID-19 vaccines, it's not really going to be a good idea for any type of government. And lastly, you can also say that, look, if we want to make this free, then this is going to be a problem because government and politicians can abuse this. Well, what do I mean by this? This means that, look, now the government has complete power to say to a citizen, like, okay, you have to be vaccinated. Otherwise, we're not going to make you go to school. We're not going to make you have a job and things like that. And we say that this is giving too much power over the government, and like it is similar to the first argument, but this first argument is more about why people should have a choice. But the fourth argument, we're talking about the impact that if we give too much power to the government, then politicians can use this to get popular votes, or government can abuse this and make another excuse to really go above and beyond and take a lot of freedom away from other aspects of life. And that's why we shouldn't really make this happen, and we should let the people decide to have a vaccine or not. So these are all the arguments I can think of, and you can also refer to my reading I have sent out for further information. We're going to also review this back when you come to the class, but I hope this video can help you to understand before class what this motion is really talking about and what are the main points of pro and con in this motion. Okay, so that's all I have for today, and I hope you get prepared, and I'll see you in debate. Thank you for listening to my video. Bye bye.